Welcome back to Your Health television program. I'm Dr. David Morwood. I am a board-certified plastic surgeon, and I'm so pleased you could be here for our next segment. We have the wonderful Gloria J. Harrell, registered nurse from the operating room. Gloria, thank you so very much for coming on my program.
You're welcome. Thank you.
I'm so happy you could come. Gloria, I've been trying to corral you to get in my program. Seems like for over a year. Gloria, I want to talk to you about a lot of different things, but you have been a registered nurse how many years?
For over 42 years.
42 years you've been a registered nurse. And you now work in the operating room.
Correct.
And I know you are an expert, and I have so many questions for you, and everybody loves to work with you and admires you. But tell me how you got to work in the operating room. Did you start off with that, or did you start off working on the floor?
No, actually I started off as, while I was going through nursing school, I started taking scrub tech, so that I wanted to work in the operating room while I was getting my nursing degree.
Okay, so there's a perfect question. So let's teach the audience the difference between a nurse that's in the operating room and a scrub tech that's in the operating room.
Okay. The basic difference is that with the RNs, many of us are trained to scrub on certain cases, on many cases, wherein the scrub tech is only role is scrubbing. Okay, unless we're doing a case where they don't really need someone to physically scrub and be in the sterile environment, they are then serve as a circulator.
Okay, so perfect. But I want to teach our audience about what we mean by scrubbing.
Okay.
So in every operation, of course, the surgeon is there with the patient. So let's talk about the circulating nurse or the circulating RN, and we'll talk about the scrub tech. So let's teach our audience what we mean by that.
Okay, as far as the circulator, what her responsibility basically is, she's the contact to the unsterile world, so that the doctor, while he's standing at the sterile field, if he needs something that's not presently on the field, she opens that and delivers it to that sterile field, so that she's their basic contact to the unsterile world.
Okay, but again, the scrub is there, scrub tech, or sometimes a scrub nurse, is there with the surgeon.
Correct.
And in sterile gown and gloves, etc., with the surgeon and the patient.
Correct.
So Gloria, you know, it's interesting to me, and perhaps to you, sometimes patients in the office, of course the audience knows that I'm a plastic surgeon, will be talking about the operating room, and they understand someone in the hospital, like a patient in the hospital, they understand the role of the nurse because the nurse essentially takes care of that patient, but they don't immediately understand why a nurse is necessary in the operating room. Now, can you summarize that? Why do we have a nurse, a registered nurse, in the operating room during an operation?
As a circulator?
Let's start with circulator.
Okay. She also assists anesthesia while he's doing an induction. She assists with him putting the patient to sleep. And once that patient is put to sleep, we also have to put monitors and position the patient. We also, based on whatever surgery that the doctor's going to be doing, our responsibility is to position the patient so that he can get the best access to that patient to carry out the surgery that he's going to be doing.
Okay.
Okay, so for the average layperson, the RN also administer medication. We also have to assist the surgeon. We may have to put Foley catheters and stuff in as well. So there are many other roles that we do. We're just not just in there to deliver sterile supplies to the unsterile supplies to the sterile field. We also have to assist the anesthesiologist, and we also have to take care of our patient and make sure the monitors are on and everything is working. All the equipment that the doctors need, we also gather that so that he can carry out the surgery that he has spoken to the patient. The patient is there for a particular surgery, so we're there to help them carry that out.
Great. Gloria, I think it's amazing that most people have this conception that the operation goes on in the operating room, and that's all there is to do. But really, there's a whole constellation of activities. There's anesthesia and the monitors, and you mentioned catheters, and there's the intravenous, there's the medicines to give, as well as all those supplies. So I find that in the operating room, the circulating nurse is oftentimes running around. I mean, there's a lot of stuff going on.
Exactly.
So let's talk about training for the operating room. So again, how did you become not only a nurse, but a nurse who works in the operating room? What's that like?
Oh, it was always exciting to me because what I felt was I got immediate gratification because I can immediately see the difference between a patient that, say, come in for emergency surgery and say they need their appendix taken out or a bad gallbladder. And once we do the surgery, they're much better. So I felt like it was something that I can do and I can immediately make this patient better. So that's why I continued on with surgery.
Right. Well, Gloria, I want to put in a plug for you as well as my own specialty. You help not only with taking out the appendix or the gallbladder, you help in plastic and reconstructive surgery.
I love reconstructive surgery.
So we do breast cancer reconstruction, we do hand injuries, and of course we do lots of aesthetic surgery or cosmetic surgery.
Exactly.
Now, Gloria, I think that you are one of the most highly trained personnel in the operating room. Now you scrub as well as circulate.
Correct.
So let's talk a little bit about those two roles.
Okay.
So we've talked about the circulating nurse, how you are running around and there's the monitors and you're helping anesthesia and you're helping the surgeon, etc. But let's talk about the world or the activity of scrubbing. What do we mean by scrubbing?
As a scrub person, it's your responsibility also to gather up all the supplies that the doctor, we have what we call preference cards. And it's a card that's made out with all the specialty things that the doctor may need to carry out whatever surgery the patient and him have decided that they wanted to do. So as a scrub, what we have to do is get that case ready, get all the supplies, sutures, medication, or whatever he needs to be successful with doing that. And then what we do is when we say scrub, that means we clean our hands, nails, and everything, and scrub it and gown up with sterile gloves and gown so that we can assist the surgeon in carrying out that surgery that the patient has asked him to do.
So Gloria, see, to me, that's one of the exciting parts of the operating room. I think it's one of the most rewarding parts of the operating room is that when the doctor and the nurse, the scrub, work together and we're right there, and with the general surgeons, you're right in the belly. When I do a facelift, you're right there with me. If we do breast cancer reconstruction, we're right there at the breast mound trying to rebuild and recreate the breast. So we're there working together. I think that's a very vital role.
Exactly. And you know, the bottom line is we have to work as a team. It's not, the circulator is no one can carry out all the tasks. So that's why we have to work together harmoniously as a team. So it's not only the doctor, it's anesthesia, it's the scrub nurse, and it's the circulating nurse. And we may have other people to come in to help out, but we all have to work together as a team, and that's the only way it works so well.
That is true. Gloria, let's teach our audience about a few specific things so people can better understand when they have an operation and why we do certain things. So let's teach our audience what we mean by NPO. What do we mean by being NPO?
That means that so that for the safety of anesthesia, they want your stomach to be empty. So when you say NPO, that means nothing by mouth. They don't want you to eat or drink anything. The only time, it depends on the time of day that your surgery is going to be done, they may allow you to take what they call clear liquids. That's anything that you can see through, which may be water or tea or ginger ale, up until a certain time, like maybe midnight or so. But nothing by mouth is what it actually means.
So I think the principle is that the stomach has to be empty. Before anesthesia. And in general, we tell a patient nothing by mouth or NPO for 6 hours prior to an operation. Isn't that correct?
Correct.
So if they're the first case in the morning, if we start at 7:30, then nothing after midnight or 1 a.m.
Right.
But if we do an operation, say, late in the afternoon, 4 p.m., they may be able to have a clear liquid, say, till 10 a.m. or 11.
Correct. Because that for anesthesia purposes, they don't want them to aspirate. And if you have a full stomach or something in the stomach, they may aspirate if they aren't empty completely.
Okay, so I want to teach our audience. What we mean by aspirate is that the food might come up and go in the wrong
in
tube,
the lungs,
in
right.
the breathing tube. So that's important to be
Correct.
NPO.
Correct.
That's why we make a pretty big deal about it.
Correct.
Gloria, let's teach our audience what we mean by the timeout. Now that's
Okay.
a relative new phenomena. Now you were just talking about working as a team, and I think that's important, because it's not just the patient and the surgeon. There's a whole constellation. This is like a solar system.
Right.
Whole constellation of activity that goes on in the operating room. So let's review for the patient, or for the people listening, what do we mean by a timeout?
Okay. A timeout is that moment in the operating room suite where the anesthesia, the surgeon, or all the cast of characters involved in this particular patient's surgery has to stop what they're doing, pay attention, and as the circulator has to read off the consent as far as what is planned for that particular patient.
So that's important. Well, it's important everywhere, and we do it here in Monterey.
Correct.
But for example, in maybe a big city or a university where there's 20 different operating rooms, and a surgeon walks into an operating room and there's a patient asleep, we've got to make sure that the right surgeon is with the correct patient about to do the proper operation.
Correct. And that's why everyone has to pay attention, and we do the timeout when everyone that is involved in that patient's surgery is present.
Perfect. Okay. Now, Gloria, oftentimes, in my office when I'm talking to people about an operation, let me back up for a moment. To us, it's not routine, but in my practice, I do between 300 and 500 operations every year. So it's not routine. We take every operation seriously, but we've become accustomed to it. But some patients say, I'm talking to them about a facelift or breast reconstruction. It may be the first operation they've ever had in their life. So they're concerned about safety.
Correct.
So when a patient is under anesthesia, let's talk about the role of the circulating nurse or the scrub nurse and safety issues. Like, how does the patient know, or what assurance can we provide that the instruments have actually been sterilized, that betadine or another antiseptic solution has actually been used, and that the operation goes according to the plan? Now, can we talk about the role of the staff in those issues?
Yeah, because that's why when I say you have to work as a team, the patient may be concerned about sterility, but we as a staff member are the first line of defense for that patient, because we have to check all the guidelines, and we have tags and things that are on the instrumentation to show us that it has been through the sterilizer, and each sterilizer has certain perimeters that if it doesn't pass those perimeters in that particular autoclave, it aborts the cycle. And so we have tapes and we have little diacs and things that we put in certain instruments, and once we open them, we know that it has gone through the sterilization process. So we're the first line, I think, of defense for patient safety as far as knowing that things are sterile that we're using on them. And we can't sterilize, of course, the skin, but we do have to do a prep of preparing the patient. So we have certain guidelines where when we're prepping a certain area that the doctor's going to be doing surgery on, that we sort of go from where he's making the initial incision and work our way out, and we never come back with that particular sponge that we have used, go out and then discard that and get another one and continue on.
So there's a very systematic way that we know that we're using sterile instruments.
Correct.
And that the skin is prepped.
Yes.
Now, Gloria, let's teach our audience a couple of things. Let's teach them what we mean by an autoclave.
Okay.
And then I want to teach them what we mean by draping.
Okay. An autoclave is a piece of equipment that we use for putting in our instrument sets once we have workroom staff that picks the set. And when I say a set, it depends on what surgery that the doctor's going to perform, and certain instruments go to that particular set. They are put together in the workroom after it's been washed and terminally cleaned. Then it is put in a set, and it is put into this big machine that has certain guidelines as far as steam, pressure, and other guidelines for reaching sterility. And once it's gone through that, it's taken out and cool on a rack, and then we can take it and put it in our pick for our cases.
So not only are instruments scrubbed and cleansed, they're put in a special machine
To be
with high
washed,
pressure
high pressure,
and
and
then-
detergent.
and
certainly.
detergent, and then they're sterilized.
Correct.
Well, that's...
And there are different ways of sterilization too. It depends on the piece of equipment we're using. We don't use gas anymore, but we have different types that we can use down in Central, like we call Sterad, depending on if you're using a flexible scope that goes through a different processing, but they're all different ways of getting instruments sterile for whatever procedure that you're using.
Well, Gloria, this is fascinating to me. And you know, we only have about a minute and a half longer. I want to pay you a compliment, and then I want some feedback about what I'm going to say. Gloria, you're terrific in the operating room, and everybody respects and admires the job you do. One thing that's impressed me is the way that you're able to comfort a patient coming into the operating room.
Oh,
Many times I've seen patients more nervous about anesthesia than anything else, and you have a way of comforting not only adults but children. And I think that's, in addition to all your scientific training, the way you're able to comfort a patient, I think is so impressive, and we're so lucky to have you.
Well, thank you.
So talk about that for a minute, your role as a nurse and that sort of the human interaction, in addition to all that scientific and technical training that you have.
Well, when I went into nursing, one of the mottos I always would tell people that I work with, treat your patient as though it was a family member. And then I realized that not everybody love all their family members. So I decided that I love everyone in my family. I'm very close and I'm very family oriented. So I treat my patient as though it's a loved one that I truly care for. And I have to be their protector, and I'm there for them. And I speak for them when they're asleep. So I make sure that everything is going as well as possible in that room, and it's just something that I just enjoy doing. It's always been something I loved.
Gloria J. Harrell, registered nurse in the operating room. Gloria, I'm so glad you could come on the program.
Thank you.
We all so much appreciate the work that you do and the contributions that you've made.
Thank you.
This is a little bit of a humorous issue, but I told you a couple weeks ago that we're only going to let you retire if we can find the keys to the handcuffs. You're not getting out so easy. Gloria Harrell,
you.
registered nurse from the operating room. Thanks so much for being here.
Thank
Certainly
you.
appreciate it.
My
I hope
pleasure.
maybe you can come again.
I
Okay.
hope so. Thank you.
I am Dr. David Morwood. This is Your Health television program. We're going to take a very brief pause for a very good cause. Thanks so much for being here. We're coming right back.